Okay, so we're on to a few exercises. I'm going to kind of start slow and then build up. So again, just kind of, go as you can, as much as you can tolerate. Don't push yourself too much, and definitely not into any pain. So one of the first things, the first two things I really want to focus on are diaphragmatic breathing. So like belly breathing as well as like glute squeezes, because they really do make up a huge part of your core, which is very essential, especially in pregnancy, because you have a lot going on there. So the diaphragmatic breathing you can do in any position, really. If you want to lay down, it's probably better. So I'll kind of demonstrate laying down. Let's see if we can just make it more comfortable. So you really want to focus on breathing through here. So sometimes I'll put a hand on my belly. Again, if you're pregnant, you probably can't do that as much, but really just try to focus there, okay? So more breathing here, less here. So what I'll do is I'll breathe in through my nose for 5 breaths. I'll hold at the top for 5, and then I'll come back down for 5. So very simple. Okay, so maybe you can see my belly rise this time. So that's huge in all exercises, just learning how to breathe from there, because a lot of times we like stress breathe, chest breathe, and it's really, we lack that core control because of the breathing. So it's something that's very overlooked a lot of times. All right, so next one, I did this also, I believe, in the knee strengthening one, is just working on your glute squeezes. So glute, pelvic floor, everything, that's the bottom part of your core. So that's very important, again, especially in pregnancy. Okay, so really, literally all you're doing, you can probably see it, yeah, just squeeze in your butt. So all of these exercises, I'll just go with either 2 sets of 15, 3 sets of 10, magic number is 30. Okay, so getting to 30, you do not need to necessarily do that many. Again, this isn't very personalized. It's a very general exercise program. So, if you can only do a few, awesome. If you can do more, that's great too. But it would be helpful to go see someone to get a more personalized one. But anyways, so if you do that, so from there, we'll do a couple more on the ground here. So I believe I did this also for the knee strengthening, the clamshell exercise. So if you're pregnant and you can't lay on your side, or you can't lay on your or on your back, then, do whichever one. You can lay here and just do the clamshells where you're opening up. And that way you're kind of working this as well, anti-gravity. But if you can't tolerate laying on your back, you can just do each side, and this works the side of your hip here a little bit more. So just coming open to the side here. Then you can do it on the opposite side. So this is your clamshell, so that's really going to help strengthen the side of your hips here. And it's a very important muscle that is also overlooked, your gluteus medius. So many people have weak gluteus mediuses, myself included. So it's a good exercise to do whenever. Let's see. Okay, so next one will be quadruped. So all the other ones we just did they're pretty basic, and they are okay for the flexion base. Now again, if you're having a lot of pain and you think it's because you're very extended, you probably want to stick to the more flexion-based exercises. But quadruped doesn't have to be extension-based. So let me demonstrate. So what you're going to do, get on all fours here. So if you can, reach out. I don't have much space here, but so you're going to start off here, squeeze that belly in. If you're pregnant, you might have a bigger belly to squeeze in, so just do your best. You're going to reach out and just kind of hold for about 5 seconds. And you can switch and hold, and you can kick out. So this is where the extension base comes in. So if you can, try not to, see how I just extended my back like that extra? Just squeeze from the butt here, straight back, so that you're not hurting your back. So, yes, no. Okay, so do that on both sides. If you feel like that's way too easy for you, you can work on alternating. So, left side up, right hand up. But make sure you're not really like tilting here, okay? So you really want to try to stay flat. Same thing. Good. So, again, you can do, if you can make it to 30 reps of that, try to hold for 5 seconds at the end for each one. That really works your multifidi muscle. So there are these tiny little muscles that go down your spine and, again, can be overlooked. They really help with rotation and stability. So that's very important. So if you can do that exercise, awesome. So I think the next couple ones I have are more progressing to standing and or like sitting in a chair. So let me grab my handy dandy chair. Okay. So I know we did some squats before, some mini squats. So again, have a chair nearby when you do the squats. Just basic little ones here, okay? So pull your belly in. Just come down just a little bit. If you can only come down this much, perfect, okay? And just working on squeezing your butt here. So those are mini squats. If you have an exercise ball, that is also very helpful. So you can also do what are called ball squats, where you put the ball against a wall, you back up to it, and you go down. And you can go down even a little further there. Or just do the mini squats with the ball. It just kind of helps with more stability there. Something else, if you have an exercise ball, that would be, you can do any exercise just sitting on an exercise ball. And that will really help kind of challenge your core. So working on sitting, pulling that belly button in, you can, raise your arms up. You can kind of march in place. You can stretch out a little bit, but again, just trying to hold yourself on that ball is already challenging your core there. So you might want to invest in an exercise ball. It might be helpful for you. So last one, I believe, is kind of like a stretch here. So many times when people have low back pain, again, their lower spine, the lumbar spine down here, tends to be hypermobile, so it moves a lot more than it needs to. And part of that could be, obviously, if you're pregnant, then it's trying to compensate for this extra weight that it's not used to. But sometimes your upper back is very tight and hypomobile. So one exercise that you could do here, more of a stretch, like I said, this chair back is a little too high for me, so we'll pretend you want to have it a little bit lower. But put your hands behind your head here, bring your elbows in so you're supporting your neck, and you're going to come back. Can you see? Yeah. I'm just going to hold and come back up. So again, you can kind of hold it back there for 2 to 3 seconds. I've also seen people put like a little ball or rolled up washcloth here to give it a little bit more oomph, we'll say, target a little bit better. But again, that's just trying to work your middle back and kind of loosen that up a little bit so it doesn't have to do as much or your lower back isn't trying to work harder and move more because the upper part lacks flexibility, if that makes sense. So I think those are kind of just some basic exercises to at least get started. Again, if you feel like you need more, I'd highly recommend going to see someone that is, maybe a women's health therapist or just a physical therapist near you, because at least having someone see you in person and getting a personalized program would be better than nothing. And then, of course, you can always message me if you have any questions, and I will do my best to get back to you. So good luck. Thank you.